And this is so stark because when you look at the statistics, and I'll get to them shortly, we're ignoring a lot of, these issues when it comes to children. But I'll break it down for you shortly. But what are some of the common mental disorders that you're looking at when you think children? I mean, like we said, there are differences. What should maybe a parent be looking out for?
Well, so I would say that every developmental age would come with something. And of course, I sound too technical to mention all of them. But it's important for us to notice those that have to do with mood, because we find that depression is very common among children. Anxiety is also equally prominent among children. Now, these are two very significant diagnoses that we look out for. For the more severe, what we normally call the psychotic disorders, you might not pick it up early because they're not able to communicate that. I mean, they may engage in some bizarre behaviors. For example, like if a child starts to say things like, Batman is always talking to me, you might assume that it's part of cartoons. They're just watching a cartoon. And so you might not pick it up there and then because, of course, children engage in a lot of fantastical thinking.
Yes.
So you might not be able to pick it up. It's only when they're growing and you're expecting them to grow past that phase and then they're still exhibiting, that's when you start to worry. But that is an indication of perhaps the onset of hallucination. Or sometimes they're having some strongly held belief that we call delusions about how perhaps they're going to be Superman in future. It's a thin line to see if this is a symptom or if it's just a child being a child.
And that's a very tricky place because as a parent, you would want to be certain, but at the same time, we take a lot of these things for granted. Exactly. In fact, I would think that maybe some children, and of course, mental health is not a permanent thing, that some children may even get there and come out without our knowing that they were there in the first place. Exactly. So when you observe these as a parent or as a guardian, what do you do?
The best thing to do is to see a pediatrician or see your mental health professional. I mean, we cannot know it all. Of course, many parents, many people have become Google doctors. Yes, you might Google it, but these things are a group of symptoms that are put together before any diagnosis and intervention is made. You might see 1 and 2, but you might never be able to piece it together as much. So when you find that something is unusual, you're not used to it, the best thing to do is to seek professional help.